We have a new development in the number of coronavirus deaths in this country. The total is now at 4, and all of them are concentrated in British Columbia. Susanna De Silva is tracking what's happening from our Vancouver newsroom. So what's the latest, Susanna?
Yeah, 3 more deaths, and those coming from the Lynn Valley Care Home, the site of Canada's only other death. All residents who lived inside of that care home. We know that more than a dozen staff members there are also infected. It is a location they have been monitoring very closely, restricting residents. We've spoken to family members who have not been visiting their family who reside inside that care home. So now 3 more residents there have passed away. That brings in total, BC saw 30 new cases since yesterday, bringing the total up to 103 so far. 6 people in acute care in hospital right now, and 5 people have recovered, though they say there are others who have recovered but have not received the official testing to tell them that they have in fact completely recovered from that virus. Now, the big concern here in BC about new potential cases is from a dental conference that happened about 10 days ago. Now, they had told people that they knew there was someone who had attended that conference that did test positive, but some of these more recent cases have turned out to be people they have traced to this dental conference. They are now telling all of the attendees to self-isolate for 10 weeks, believed to be about 15,000 people who attended that conference. Previously, they had received letters telling them they may have been infected, but not telling them to go into self-isolation. That has now changed, as they are concerned that, in fact, more infected people may have attended that conference. And of course, the concern then also turns to the patients that these dental professionals have been treating and seeing since that conference. Here's Dr. Bonnie Henry.
Dentists and dental hygienists are healthcare professionals, and I would hope that none of them would work if they were ill, and that's where we know the risk is with this for the most part. Dentists also take infection prevention and control precautions within their offices. So unless you have been notified by public health that it's a concern, then I think most people are fine.
But we have already heard from some people who are contacting their dental offices to find out if anyone who worked there had attended that conference. So certainly there is concern, reason for people to be self-monitoring. The province also announcing a number of new steps around the coronavirus. Of course, the no more than 50 people at a gathering, which has been announced across the country. But casinos are closed. They're still in talks about schools, which are on spring break right now. Talks about daycares. They've stopped short of closing restaurants. They've just talked about that 50 number, but stopped short of telling restaurants that they do have to close. They've now allowed it for prescriptions to be renewed without people going to their doctor's office to get those done. They're also moving hospitals into outbreak mode. They are canceling thousands of elective surgeries, trying to clear up as many beds as possible. Dr. Henry says that at this point, she believes that there is still chance to stop that curve, to get to that point that overwhelms hospitals, but that they are trying to move with these aggressive actions to try to prevent that from happening.
Earlier today, the Prime Minister announced the travel ban here in Canada, but BC's health minister is calling on the federal government to do more.
Yeah, the Minister, Adrian Dix, was not happy with the extent at which they went. He says they're happy with the other measures that they're taking, but he believes that more should be done, especially in the case of British Columbia, that shares a border with Washington State, which has been particularly hardly hit by this virus, where they've seen more than 40 deaths, more than 700 cases there. This is Minister Adrian Dix.
We remain concerned that access from visitors from the United States continues to be allowed, given the situation particularly in King and Snohomish County in Washington State, which affects British Columbia more than anyone else. It's our strong view and it's our strong message that visitors from the United States not come to British Columbia. Don't come, because at this moment that is the wrong thing to do. We understand that people are being asked to self-isolate, but better than self-isolate for visitors is not to come.
But of course, that is a federal measure, and of course, these things are changing on a daily basis. But at this point, anyone coming is being asked to isolate.
Susanna, thanks for the update. Appreciate it.